Welcome to Showcase Richmond. I'm Chip Tarkenton. Being told you only have a certain amount of time to live causes emotional anguish and hardships that only the person being given the prognosis can truly understand. However, in this time, it may seem so dark, is an organization that brings a glimmer of light in its ability to listen and comfort the patient, family, and friends, and help bring dignity and quality of life to the patient. That organization is Hospice Community Care, and that's the focus of Care Advantage's Good News segment. Care Advantage offers quality and caring home health care around the clock. Here's more.
Care Advantage means that I can face each day with a positive. You don't have to go to bed at night wondering, how am I going to get through tomorrow? Because you already know they will be here to help you get through that day. They care about the people they're helping. It's special.
Don't do it alone. Call Care Advantage and find the peace of mind you've been searching for.
With us now is Melinda Jones. She is the professional and community liaison for Hospice Community Care. Welcome and great to have you in. Give us a little background on Hospice Community Care.
Hospice Community Care started in 1997 in Ohio. We have offices in Ohio, Illinois, Indiana, Oregon, Newport News. Our Richmond office has been here for about 6 years now. We're located off of Gaskins and Broad in the West End. We service a 50-mile radius of our office. So we give services to home patients, nursing home, assisted living, independent, wherever there's a need for hospice.
Help us with some of the myths of hospice. What are some of those?
There's several myths associated with hospice we often hear. The first being that someone has to just have days left, be at very end of life. And we do quite often see that. But as soon as somebody is diagnosed with a terminal illness where aggressive treatment is not going to work, or they choose to not have that aggressive treatment, they can typically be appropriate for hospice. We often hear that someone has to have cancer in order to be appropriate for hospice. We do see a lot of cancer patients. We also see Alzheimer's, Parkinson's, COPD, congestive heart failure. And then also families feel that if their loved ones sign up for hospice, there is no coming off of it. We do have success stories with hospice. Some people get better, and we have to discharge them because they no longer meet the hospice criteria. And then we have some who decide they want to seek aggressive treatment, and they come off of hospice and get their aggressive treatment, which is fine.
Give us some of the benefits of hospice.
There's a lot of benefits with hospice. We really strive to seek the emotional, physical, and the spiritual needs of the patients and their families. We really individualize the patient's plan of care for symptom management, pain management. We essentially become the 911. It eliminates those ER visits, hospital visits. We treat all the needs to where the patient is so that they can remain there and age in place. We also offer a lot of support to the family. We cover a lot of the medications, a lot of the equipment to take that financial burden off of the patient and the family. And we give 13-month bereavement services after the loss of a loved one. So we continue to stay in there, be a support system. We're available 24 hours a day, 7 days a week. And being proactive and really individualizing the plan of care gives quality and dignity at the end of life.
All right, briefly, we want to make sure we get to a big event that's coming up, and tell us about one the entire community can be involved with.
We are doing an event. We're partnering with Rest Care Home Care, and it's going to take place August 23rd through October 23rd. We are going to be collecting donations for each pound lost. Those proceeds will be donated to the Alzheimer's Association. We will be donating to the Cancer Society.
Yeah, it's going to be a great event. The telephone numbers are at the bottom of the screen if you'd like to be a part of it, and it is going to be a wonderful, wonderful event. Let's put the contact information up on the screen, how you can get in touch with Hospice Community Care and with Care Advantage, their information as well. Hospice Community Care, you see the address on West Broad Street, you see their web address, you see their telephone number. Make sure to give them a call. They can really help you out. Care Advantage bringing us this segment. We really appreciate them being a part. Melinda Jones, outstanding job, and thank you for helping us and understanding exactly what Hospice Community Care is all about.
Thank you.